When it comes to diabetic foot care, even small mistakes can have huge consequences. I've seen patients lose toes or worse because of things that seem harmless, like wearing the wrong socks or skipping a daily foot check. But here's the good news. Most of these problems are entirely avoidable. Today, I'll share the 5 biggest mistakes I see people make with diabetic foot care and how you can fix them to protect your health, your feet, and your future. For those who don't know me, my name is Dr. Voltaire, the Wound Doc, a wound care physician with years of experience treating diabetic foot wounds. I've helped hundreds of patients heal from complex injuries and prevent further future complications. Today, I'm here to help you take control of your health with practical, evidence-based advice. By the end of this video, you'll know the top 5 mistakes that could be putting your feet at risk, how to avoid them, and the simple habits that can keep your feet healthy for years to come. Let's get started. One of the biggest mistakes I see is people ignoring small changes in their feet. Maybe there's a little redness, a tiny blister, or a patch of dry skin, and you think it's nothing. But for someone with diabetes, those small issues can turn into big problems fast. Diabetes often causes neuropathy, which means you might not feel pain in your feet the way others do. That blister you don't feel could become a serious infection. That dry skin could crack open the door for bacteria. So here's the fix. Make daily foot checks part of your routine. Use a handheld mirror to check the bottoms of your feet. If you can't see them easily, look for redness, swelling, cuts, or any changes in color or texture. If you spot anything unusual, call your doctor right away. Let's talk about shoes. The wrong footwear can do more damage than you think. Tight shoes, high heels, or even going barefoot can lead to pressure points, blisters, or injuries that your feet can't handle. I had a patient once who wore the same tight sneakers for years. Over time, the constant pressure caused a foot ulcer that took months to heal. Here's what you can do. Invest in well-fitting supportive shoes designed for diabetics. These shoes have extra padding, wide toe boxes, and minimal seams to prevent friction. And don't forget to check your shoes before putting them on. Small pebbles or debris can cause major problems if left unnoticed. Dry skin might not seem like a big deal, but for diabetics, it's a major risk factor. When your skin is dry, it's more likely to crack, creating entry points for bacteria. I've seen patients come in with infections that started from something as simple as cracked heels. The fix is simple. Moisturize daily. Choose a fragrance-free thick cream or ointment and apply it after bathing when your skin is still slightly damp. Avoid putting moisturizer between your toes though. That can create too much moisture and lead to fungal infections. Here's a mistake people often overlook: not keeping blood sugar levels under control. High blood sugar doesn't just affect your overall health, it directly impacts your feet by slowing down wound healing and weakening your immune system. If your blood sugar is too high, even small cuts can take weeks to heal, increasing the risk of infection. So work with your doctor to manage your diabetes effectively. And remember that foot care starts from the inside out. Last but not least, skipping regular foot checkups with a healthcare provider. Even if your feet feel fine, a professional can spot issues you might miss. I had a patient who didn't realize they had a developing ulcer under a callus until we caught it during a routine exam. Without that visit, it could have led to serious complications. So make it a habit to see your provider at least once a year, or more often if you're at high risk. Prevention is always easier than treatment. Diabetic foot care isn't complicated, but it does take a little effort. By avoiding these 5 mistakes, you can protect your feet, prevent serious complications, and live more comfortably. Thanks for watching. If you like this video, check out my next one on treating and preventing calluses. Stay informed and heal well.